people, and there are some very important questions that there are two questions I would basically run it by the panel members, and what I want is you guys to provide at least 1 minute to 2 minutes of your opinion or your response to those questions, and then we will see if we have enough time to allow any questions or responses. So the first question that we were able to receive and which received most requests is, what are the opportunities in analyzing healthcare data? So given you are the first to go, ma'am, I would request you to give your thoughts around what are the different opportunities in analyzing healthcare data.
Sure. So definitely data is everywhere. Data definitely is there in healthcare as well. So I would look at it first inside hospital, outside of hospital, at home. Right? The types of data that we can think about. Once inside of the hospital, much earlier on, most of the things had to be written down notes. And so let's start with that. There are some hospitals which do note taking, like, the doctors make notes, or the nursing staff or an assistant makes notes. So starting from there, how do we translate? How do we convert that into a digital enabled, sort of processable data? So the OCR, that is optical character recognition, handwriting recognition, these are also, and it's the most challenging piece is to understand a doctor's handwriting, right? It's the most challenging AI problem, I would say, from an imaging perspective. So that is one piece. And let's say that's off, and then you have the data available in electronic medical records, which many more hospitals also do that, use computer systems to capture data about the patient. It could be like the blood pressure, heart rate, sugar, all of these kind of health vital data. Or the person could be, unfortunately, in an ICU. So there is a continuous monitoring of data using a bedside monitor that may be happening. So it can be just patient data, which is like one-shot snapshot data, or continuous data, right? So where you want to look at abnormalities that are cropping up as time permits, even a single, real-time nature, right? Even a single minute saving, can be a huge benefit. So the first is the clinical information, analyzing that using machine learning and other techniques to figure out a state that could happen in future, maybe 4 hours from now, 4 years from now, 2 years from now, whatever. It's the time period can be different depending upon the disease we are trying to predict. If you can detect an abnormality that is going to occur in future, right, and take action now. So machine learning is very, very suitable for this. Predictive analytics, you can be slightly wrong, no worries. You are 90% accurate, that's fine. But if you are able to identify a condition, an abnormal condition that is going to happen in future, and take action now, you're saving their lives. And that's a huge, huge opportunity, because there are millions of diseases, and we all know as machine learning engineers that you cannot build a one magical machine learning model for every damn disease there, right? So every disease, every sub-disease also requires fine-tuning of AI models. For example, when we talk about cancer, breast cancer, we are able to detect 5mm, which is almost like 5 to 8 years before cancer gets detected which is really saving the rest of her life. Giving her 30-35 years of life is not a joke. That can be done, and that we have seen it happening in machine learning. So that's a huge space. Another huge space is what I call as non-clinical applications of healthcare. This could be in the form of just inside a hospital. I'm staying, looking at data inside a hospital. So here we could talk about how to improve operational efficiencies, right, inside a hospital. So you see hospitals with loads of patients waiting for hours together. How can we cut down the waiting time of this? How can we do that? By, again, tools to be given to the doctors, figuring out how many people are waiting at which place, and adding more resources. As simple as that, right? Queuing systems, and then estimating the number of people that will be there on an OP, let's say on Monday at 10 o'clock in an OPD, and add enough number of resources there. As simple as that, right? But that's a very, very useful thing, which improves the patient experience. Then outside the hospital, there are umpteen number of wearable devices that's coming in, right? The IoT devices which are coming in, which could be many of us wear this Apple Watch or Samsung Watch, which actually measures how many steps you took, what's your respiratory rate, BP, and all of those, right? So how can you do this continuous, this fun items that you wear on your hand, how can you convert them into continuous monitoring systems? And so here, the challenges will be to do those kinds of predictive analytics and fusion of sensors, you would say, right? Different types of sensors, and then give real-time signs saying, you better go to hospital tomorrow, right? These kinds of things. So I can go on and on. Maybe I'll give these three pieces as some huge applications of AI in healthcare, and I will request the other panel members to add.
Thank you, Geetha ji. Do we have Dr. Ramachandra?
Yeah, I'm here. Good afternoon.
Good afternoon,
Can
sir.
you hear me?
Yes, yes.
Yeah. Basically, I'm the genetics students and the learners of the genetics, human genetics and fly genetics, major things. What I wanted to tell here is that the pedigree in human system is a very classical example where you can predict even for few next generation or further generation or from the earlier generation. It's a tree, family tree. If you know the diagnosis properly, or the phenotype properly, or the symptoms properly in any of the patients, and also now we have excellent technical systems like genome sequencing from 1990. Are you hearing me?
Yes, sir.
Yes.
Yes, all this genome sequencing and even now individual targeting analysis or diagnosis is very excellent. With the artificial intelligence, we can make a standard pipeline, standard system where the wrong diagnosis will be avoided, even wrong prediction can be avoided, and the whole family can be, we can predict that. Okay, now for example, one of our research students, she made a gene panel that about 14 genes. If you screen those 14 genes, the family which has the Parkinson disease, we can predict that the people, the family, when they might get the, they have the genetic defect there, or if the possibility of getting not, we can predict that. So if you pool the phenotypic data and the genotype data, correctly program and using artificial intelligence, the right kind of pipeline, right kind of algorithm, the all complex diseases where this is a big challenge now. And for example, now I'll take it to the corona now. There are two things are happening there in my view. One is the environment where touching and all those kind of things. Other is the sensitivity or susceptibility of the individuals. All are not who are touched, they are not positive because they do have resistant gene, genotype. They say immunity means the genotype. So the human being among us, we are 0.4% differences in our genome sequences. The 3.2 billion base genome sequences, 0.4% difference. What does it mean? So 4 million base differences we have. Even one base or couple of base in different genes. Now we are able to understand, integrate them. This AI correctly can predict the disease in an individual, in a family. Now again in India we have more than 6,000 communities, so we can assess that this kind of disease runs in this kind of community, in the family. Once we have all this data together, easily one can predict for our different caste, community, religions, especially India and Middle East. This is the way the artificial intelligence, which gives accuracy, whatever the data we give, whatever the data pool, it gives a lot of things. Another thing is that the prevention, treatment, and the diagnosis, and even the management, also they can propose for with the this kind of the artificial intelligence with the data analysis here. So most of the complex diseases we are in challenge. We have thousands of medicine for heart patients or hypertension. Which one to give? Sometimes they predict. All our medical systems, I hope doctors believe me, they do trial and error with minimum of analysis. So if you do the complete genome analysis of that family or the individual where they have a problem, with this integrated with the artificial intelligence, I think we can make a complete the assess or even treat disease very properly. We have made one interesting case of a candidate. Can I speak 1 more minute?
Sure, sir. We have one more very important question, but you can continue for 1 more minute, and we'll have Dr. Sharada share her views, and then we'll address another question.
Yeah. Good. Now, quickly. So we have somehow we got one patient with 35 years old, did not had any family background, but he had the heart attack, even diabetes, and 8 blockages we could able to see in that patient with the whole genome sequencing. And when we had the clinicians ourselves with the data, we could able to monitor the drug, and the patient is recovering now. So he recovered. This is a long data we have. So that way, the fine tune of the genomic data and the phenotypic data, the symptoms, whatever the symptoms or the clinical phenotype we have, if we integrate, make a right kind of pipeline, this artificial intelligence certainly screen properly the patients. And many of this the system now what we have, the wrong diagnosis, all those things can be avoided, and certainly it will going to be a boon for health industry and healthcare. Okay, thank you.
Thank you so much, sir. That is a lot of information and insightful information around the genome, as well as the genetics, as well as the corona. Dr. Sharada, if you're there, can you please also shed your insights on the opportunities in analyzing healthcare data, the things that you can share? And if you can also follow up with another question so that we can do a reverse, so that you will answer 2 questions, and then we'll have Dr. Ramachandra, and then followed by Geetha. The second question that you can address right after the first question is, will AI replace doctors and nurses?
Okay.
So,
hi, Prashanth. Am I audible?
Yes, you are audible, Dr. Sharada.
Okay. Hi, everyone, and thank you so much for this opportunity. It's been tremendously insightful past few days. I shall address the opportunities for data in healthcare with a few examples, and probably the point gets driven home much further with certain therapeutic areas. So I wanted to look at sepsis first, and this is a very little addressed area, and sepsis is typically a condition that affects infant mortality tremendously, as well as senior citizens tremendously. And in both cases, the symptoms really cannot be conveyed, largely by the person. And so I wanted to look at how AI has an opportunity in certain targeted early warning systems that can be developed using AI. So if you look at private neural networks, all of yesterday we were in discussion about neural networks and how you can actually have targeted studies and targeted data. So most of the patient data that resides in EHR, electronic health record systems, or any other health databases today, if you were to kind of indicate the patient population that you're targeting, and if you were to give it a few definite goals in terms of outcomes that you want to either track or measure and create algorithms for, there are ways in which prior predicts can be made, and ML pathways can be created to teach a neural network how to be able to predict sepsis occurrences much in advance. And this is already this is being done in other areas like TB, and in just like the doctor said earlier just now, in cardiac patients. So if you are looking at not only sepsis, but in senior citizens, there are occurrences of comorbidities as well. So for patients who are diabetic, or patients who are who have lymphoma and who have a preponderance of clotting, right? So that leads immediately to stage 1 and stage 2 of sepsis. And the reason why I'm dwelling on this is because the response time for a condition like this is very, very less. So if a person could really start with something very small like a foot sore and then lead up to septic shock within 3 weeks, and the fatality occurs. In infants, the window is even lesser. It's just like 5 days. Within 5 days, a patient is at risk. And this is the 11th leading cause of death. And so that's why I wanted to open with the opportunity for data and focused machine learning that can be created towards a sepsis condition. What we could do is look at heuristic data from EHRs, analyze the data for sepsis symptoms, look at certain add-on data like creatinine levels and so on, and then club it with comorbidities, and then create algorithms for both detection and diagnosis and treatment. Now, what are the advantages of something like this, where you're saying that it has already been done using neural networks, detection has been done. Now, if you're comparing this with a correlation that similar such studies are happening worldwide. Last year, I was working on a product with a player called Clincomatic in the Bay Area, and we were looking at a very, very simple use case of all clinical trials that are being conducted worldwide for a condition like this, and what is the work or progress that has been made across the clinical trials, and then sort of marry or collaborate all of that work between doctors. So the speed is added to the solutioning, and the insights are much larger, very definitely. So if you're looking at heuristics, if you're looking at data correlation between work that is already in progress between doctors, and then you're leveraging vast amounts of this focused information, and you're definitely looking at quicker insights that you can draw from the same. This is the first area that I wanted to talk about. And there are studies in progress in other.
Sorry to interrupt, but given the schedule, is there any way you can conclude this so that we can give everybody 30 seconds to answer the second question, if AI will replace doctors and nurses?
Yes. So if you are looking at the uses of prior detection, another area that I wanted to quickly mention is osteoporosis. So there are, again, machine learning opportunities where you are analyzing the water component in cartilages, and you are able to have interrelationships between pixels in MRIs. So if you are able to identify that specific data point that you analyze, it is very easy for us to be able to start off a research group and create private neural networks. So this is the first point that I wanted to address as an opportunity for data in healthcare. Now, coming to your second question, the second question is much more simpler to answer. Although there are tremendous headway that has been made in AI in healthcare, there is definitely a long distance to go, and many years before machine or AI can replace doctors. Some of the areas that I can straight off talk about is AI ethics. So there are really miles to go in terms of ethical treatment. Then there is the human component with doctors. So even though there are repetitive activities that can be performed by AI, still the diagnosis and the human interaction that a doctor brings to the table, and the years of experience, definitely, you can't teach to a machine. So that is the short answer for the second question.
Thank you so much, Dr. Sharada. I would like to get back to Dr. Ramachandra. If you can conclude this in 30 seconds, if will AI replace the doctors and nurses, and then we'll follow up Geetha ji as well. It's I wish we had more time. It's just that we have a jam-packed session to complete the other tracks as well. And since it's a Sunday, we just wanted to make sure we'll do this. But again, with the enthusiasm we're receiving, hopefully in future we'll set up a special session for healthcare and bring you guys industry experts to address questions and answers. So, Dr. Ramachandra, will AI replace doctors and nurses?
I don't think right now it will replace, but it can reduce the persons. It can reduce the person. Only the people who have the good knowledge, good understanding, those people can be, continued and it will be encouraged. But AI certainly bring the more the clarity and knowledge and avoid the wrong decision, diagnosis, and so on. I think this is very, very important. In coming the AI in the healthcare is very, very important. So this way we can save many the people who are in a problem, in a miseries.
Thank you so much, Dr. Ramachandra. Geetha ji, next over to you, and then if you can conclude this, that would be amazing.
Sure, 30 seconds. Last December, I was in Radiological Society North America of 1.5 lakh radiologists and another 7,000 oncologists in one room. And then we debated this, lot of AI, how it helps and all that. And only one sentence, and really want to summarize this, right? Radiologists who use AI will replace radiologists who will not use AI. AI will not replace radiologists, but radiologists who are powered by AI will replace radiologists who are not using AI. And this is applicable across the board. I think this is where the future is going. Thank you.
That's fantastic. I wish we can answer some questions. We'll get back to you personally on any particular questions you want to address, guys. But thank you so much, the panel members. Over to you, Narendra.
Thank you very much for that.
Thank you, Geetha.
Thank you very much, Geetha. Thank you very much, panel members and the moderator. Thank you very much for that insightful information on impacting on healthcare. Now let's quickly move on to